Maternal mortality rates in Texas, some of the worst in the country, especially among black women.
Studies show black women in Texas are 3 times as likely to die during pregnancy or childbirth than any other. The KVUE defenders have been following this issue for years. KVUE's Ford Sanders met with women in healthcare and Texas lawmakers about this problem. Ford?
Quita, Brian, the KVUE defenders dove into years' worth of data. A study by the American Medical Association showed back in 1999, the maternal mortality rate in Texas was around 10 mothers per 1,000 live births. Well, 20 years later, that more than doubled to 22 deaths. And it hasn't gotten any better, especially for black mothers in Texas, whose mortality rates are among the highest. A group of women sharing their stories as another group listens in on the importance of maternal health.
What we do is we assist women with disparities because black women are the highest for disparity for preterm pregnancy.
Austin Public Health bringing in women, men, whoever may need to hear about the ways to advocate for themselves and family. Eva Roberts is an Austin doula. She helps guide pregnant women through labor, but says it's also her job to make sure women and mothers are being heard.
You got somebody here that can help you, and I'm willing to go the extra mile.
While a panel like this focuses on health in general, there's an underlying reason for these types of chats.
Back 38 years ago when I had my preemies, we didn't have anybody to help me, nobody to come talk to me about my disparity or what I went through.
But for some, these experiences continue. Worldwide, the U.S. has some of the highest maternal mortality rates, with more women dying from pregnancy, childbirth, and postpartum, and black women are impacted the most.
Racism, access to services, late prenatal care, birth spacing.
Cynthia Washington with Austin Public Health's Maternal Infant Outreach Program, better known as MYOP, says a major contributing factor is women afraid to speak or not taken seriously.
And a lot of women of color, period, don't know that they have a right. They don't know that they have a right to tell the doctor, hey, I'm hurting.
A 2023 study from the American Medical Association shows black women are 3 times as likely to die from pregnancy or childbirth in Texas and southern states in general than most all other ethnic groups.
It's just like anything. You would always start with the most affected group to be able to help the whole.
State Representative Sean Thierry knows about black maternal mortality all too well. Her district in Houston is an example of where mothers see gaps in care. The issue of black maternal mortality isn't just specific to Central Texas, it's statewide. So that brings us here to Houston. Well, the Women's Hospital of Texas actually has been rated one of the best places to have a baby 2 years in a row. But you go just a couple miles down the street, right here in the Sunnyside neighborhood, it's a much different story. This is actually one of the worst places when it comes to maternal mortality rates in Harris County. It's exactly one of the reasons why women all over the state are advocating to get this issue dealt with. And Representative Thierry has a story of her own.
I couldn't breathe, and I was just in excruciating pain, and I started, letting the doctors and nurses know, but it took a while before they believed me.
This is what she dealt with when giving birth to her now 11-year-old daughter.
The little smirk, this just kind of encompasses my daughter's personality.
Thierry was given a high spinal epidural. She recalls feeling the meds reaching her heart.
They kept saying, no, you're fine. I promise you. I was saying, no, listen to me. I promise you, I don't think I'm going to make it. I was trying to use mind over matter.
After her traumatic birth experience was over, she says the torment did not end there.
My doctor came in the room and stood at the door and didn't even come all the way in and said, hey, crazy lady, I heard you went crazy in there. And I was thinking, what? You mean you heard almost died from a high block epidural?
She says a lot of women deal with situations like hers, so she's been fighting for change at the Texas State Capitol.
This past session was finally able to join author and pass legislation that will extend Medicaid coverage for women, low-income pregnant mothers from 60 days to 1 year.
Thierry says this is just a start.
I have several pieces of legislation that have not made it all the way to the governor's desk. Some of them passed the House and they die in the Senate. Some things don't get a hearing.
But considering Texas's strict abortion laws, she says this issue needs fixing now more than ever.
Be a voice for a person that can't speak up, can't speak out, and let them know that you got their support.
All 3 women agree. It starts with being clear about what you feel.
One thing that we can do is educate and have health literacy so that people can know. And so that's one thing that we teach. We're all community health workers.
A community working to save lives. In Austin, for the KVUE Defenders, Ford Sanders, KVUE News.
You can find this story on KVUE.com now. If you have a story tip for the KVUE Defenders to investigate, send an email to defenders@KVUE.com or call 512-533-2231.